So we're going to talk about the skeletal system today. Okay? So the first thing we're going to talk about is what's referred to as compact bone. So we have two different types of bone. One is called spongy bone, and the other is compact bone. And they are given their names based on what they look like. So compact bone is a lot thicker, it's much more dense. I'll show you some pictures of it in a minute. And spongy bone looks a lot like a sponge. It's got a lot of holes in between. It's not as dense. When you look at compact bone microscopically, this is what we're looking at. So this is a picture of compact bone underneath a microscope. And this entire area here is surrounding this little canal here. And you can see all the bone that grows around this canal. This entire picture that you see here is what's referred to in compact bone as an osteon. So you have in compact bone multiple little canals with all this bone around it. So we're going to talk about how this is built, what it does, and so on. So the first thing I want you to know is that there are cells inside this bone that help to grow bone. These cells that are found in compact bone that help to grow bone are called osteoblasts. And typically what happens is you have this osteoblast, and it starts growing bone in such a way that the bone begins to grow around it. And it will grow around these osteoblasts in rings, so that you get these layers of bone that are occurring. And then you might have another osteoblast sitting about here, and it starts having layers of bone growing around it. So that when you look at these little black dots right here, these are the areas where the osteoblasts sit, and then the bone is grown around each of these cells or these osteoblasts. So you can kind of think of it as if, you know, you're standing still and somebody is building a brick wall all the way around you, all the way up. And somebody's standing next to you and they're building a brick wall, and your brick wall and their brick wall touches. Somebody's in front of you building a separate brick wall all the way around them. You're the osteoblast. You are building this brick wall around you. Eventually, the brick wall is completely encasing you. On top, underneath, in front, behind, it's totally around you. You can't build anymore because you're totally encased in this brick wall. As soon as the osteoblast encases itself in this bone, it can't grow bone anymore. And so that osteoblast basically just sits inside this prison it's made for itself and can't grow bone anymore, but we call it an osteocyte. So it's just sitting in this region, and it's not able to grow bone anymore. Now, the region that it's sitting in, if you look here, this little black region right here, okay, you see all these little black kind of dots right here? This is where the osteocyte lives. It stays there your whole life. This hollow region that the osteocyte stays in is called a lacuna. Now keep in mind, this is all occurring in compact bone. We don't have the same setup in spongy bone. Okay, so let's kind of look at the cartoon a little bit so you get an idea here. There is the osteon here with a little central canal. Here's another osteon with a central canal. You've got another osteon with a central canal. Going up and down these canals are blood vessels and nerves. And so your bone is alive. It's constantly got to have blood supply. It has to have a neurological supply. And each one of these osteoblasts that sits in this little lacuna here has built bone around it to the point where it can't move anymore. It's totally bricked in. And now we call this an osteocyte. So anytime we're growing bone, you use the word or the term blast. Anytime it's already grown, it's called a site. Okay, so what is this black region right here called? This is the lacuna. This is the canal, what they call the central canal, that the blood vessels go in and out of. If I told you that this is fully grown bone, what type of cell lives in this lacuna? It's an osteocyte. Now, I don't know if you can tell very well, but see the little lines that go from lacuna to lacuna? There's some little lines here, and you can probably see it a little better here. This is a lacuna, and see all the little lines in between. Each one of those lines does allow the osteocyte to do a little bit of communication with its buddy so that it's not totally lonely, I guess. It's able to send out different chemicals. Those lines of communication between the osteocyte, I know you're going to like this word, it's called a canaliculi. Okay, so you got some terms. You have the osteon, osteoblast, osteocyte, lacuna, and the canaliculi. These are all found in compact bone. Now notice in this picture how tight all the bone is, how dense it is compared to right here. This region right here is actually called spongy bone. And so you can see the spongy bone has all these little holes in it. The bone doesn't form in these osteons. It doesn't have this pattern. It's very, very different. And down bones, and it looks like I don't. Okay, so these types of bones are what are referred to as long bones. And that's simply because they're longer than they are wide. So in comparison to like maybe a skull bone, they're very typically wider than they are long. So this is a long bone. The outside of the long bone is made up of compact bone. But these long bones are actually hollow in the middle. Okay, and I don't know if you've ever heard of like bone marrow, all right? But that's part of the hollow part in the middle. If you could look at the middle of this bone where it's hollow, the hollow region is lined with the spongy bone. Also, at the ends of these long bones, they are full of spongy bone. Now, the spongy bone is really very important, especially when you have fetal development, because this is where we make most of our red blood cells. Now, as we get older, not all spongy bone makes red blood cells anymore. We only have spongy bone in this part of this bone, which is called the femur. It's your leg bone, okay, your upper leg bone. And this is called the head of the femur. And we do make red blood cells in the head of the femur in this spongy bone. We make red blood cells in our pelvic bones, a little bit in the bone that's right here called the sternum, but we don't make it throughout all spongy bone like we did when we were a fetus. But these bones are heavier, they're thicker, they're very difficult to break because they're surrounded with this compact bone with a really thick layer of it. So again, we're talking about the lacuna, which are the little holes, and then they're interconnected by the canaliculi, and then we have the central canal. What is this entire circular region called? The entire part? The osteon. Very good. So we have the canaliculi so that the osteocytes can communicate, so that nutrition can go from one to the other. Also, in this central canal, what would you find there?
Blood vessels.
Blood vessels. What else?
Nerves.
Nerves. Exactly. Okay. So spongy bone, again, doesn't have a very organized appearance like the compact bone does. And when you look at spongy bone, these little parts of the spongy bone, okay, each little piece of bone here, this is referred to as a trabeculi. So the trabeculi are little pieces of bone that come together to help form the spongy bone. So this is a picture of the inside of the head of the femur, and you can see all in the head of the femur here, this is all spongy bone, and it really does kind of look like it's made out of sponge. On the outside here, this is the thicker bone, this is all compact bone. And then straight down the middle of the shaft of this bone is going to be where we have the bone marrow. Now, the bone marrow, you have what's called red marrow, and you have yellow marrow. The red marrow is where we can find red blood cells. And the yellow marrow is simply fat. Now, believe it or not, all of our bones are alive. These osteocytes, osteoblasts, they have to constantly be fed, which is why in the middle of our bones we have a really good supply of fat. That fat also helps to cushion the bone. So as you walk, there's actually some cushion on the inside of the bone. But this is like when dogs eat bones. If you've ever watched, they like to crack them open because the marrow is full of a lot of nutrients. I don't know about your dogs, but my dogs love to suck the marrow right out of it. So again, this is what our spongy bone is looking like. And then a little bit more kind of a picture, cartoon sort of thing. You can see this is the spongy bone, and each of these pieces of bone are the trabeculi. And then this is our compact bone. On the outside of all of our bones, there is a covering that is made up of what we call connective tissue. Have you guys talked about connective tissue in lab yet? Have you guys gone over any slides looking at, no, okay. All right, so there is a type of connective tissue. This helps to hold things together. And we have around all of our bones a really shiny, glossy connective tissue. And this connective tissue, doesn't matter what kind of bone it is, all the bones have this. This connective tissue is called the periosteum. So let's say that I fall and I break a bone in my leg. How is that bone going to heal? Well, we've talked a little bit about stem cells, right?
Yeah.
And that stem cells have the ability to turn into any kind of cell. Well, in the periosteum, we have an abundance of stem cells. And they sit around just waiting to be able to heal the bone. So if we break that bone or injure that bone, the stem cells in the periosteum can turn into osteoclasts. And now we can grow more bone. And by the way, when those stem cells turn into osteoblasts, they're really good workers. Because wherever you break your bone, they actually make that part of the bone thicker, sometimes as much as twice as thick as the original bone was. And you can actually see where you break a bone, how with some people, bone will be sticking out all the way around. You'll have like this collar of bone sticking out all the way around to really make sure that that break is nice and hard. So it's really hard to break a bone where you already have broken a bone because it's actually thicker and stronger than you started out with. But the periosteum is really there to hold on to those stem cells so that whenever we break that bone, we have the ability to fix it. So we talked about the red bone marrow. This is where our red blood cells are located. And in infants, this is where most of our red blood cells are produced. And in adults, we do have red bone marrow in the spongy bone, especially I told you at the ends of like the femur, in the sternum, and in the pelvis, these are the regions we see most of the place where we make our red blood cells now. So this is a microscopic picture of what a osteoblast is looking like inside this sort of little hole here. Again, what is that hole called? That's the lacuna. Okay? So here's the bone marrow. And then here's our spongy bone at the very end here. We have a little bit in the marrow lining the walls. And then we have this thicker bone, which is called what again? That's the compact bone. Okay. So now, when you're looking at bone, it's really important to be able to tell like one side of the bone from the other. But we also label what we would call like the long part, which is the shaft of the bone, versus the ends of the bone. So I want you to know that the ends of these long bones are called the epiphysis. The shaft of the bone is called the diathesis. So the epiphysis would be the ends, the shaft would be the diathesis. Okay, now, there's two other terms you need to know. Medial and proximal. Okay? Okay, so look at the femur. Okay, so this is our femur bone. This portion, this epiphysis versus this epiphysis. Which one is medial? Which one is... Oh, I'm sorry, I did it. I don't know why I did that. I'm sorry, I apologize. It shouldn't be medial. We're not going to use that. We're going to call this distal and proximal. I did it totally backwards. Oh, thank you. I appreciate that. All right, let's try this because that's absolutely correct when we talk about bones. So we need to know which part of the bone is closest to the body, which is the furthest from the body. So proximal means closest to the body, distal means furthest when we're talking about bones. Okay, so if I tell you this one right here with this kind of ball thing right here, this goes towards the hip. Okay, so which one would be closest to the body? Which end? My right or my left? The left. So this would be medial, or excuse me, I was doing it again. This will be proximal, this will be distal. You're in a very forgiving mood today, I appreciate that. Okay? All right, so now what if I show you this? Let's look at this bone. Okay? So it's going to be like this. Okay? So which end is proximal? Right or left? The right. So closest to the body, proximal. All right, so now look at your fingers. Which part of your pointy finger, okay, your first finger, which part of it is proximal? The one closest to the hand. So then the one that's with the fingernail would be distal. That's right. Okay? So two very important terms for you to know. Okay. Now, when a fetus is developing, okay, so baby's still inside mom, still developing, not yet ready to be born. Bones are not bones yet. Bones are in kind of a pre-state, you might say. They're not totally hard, and instead of being made out of bone material, they're made out of what we would call cartilage. And cartilage is much more flexible and bendable. So imagine if mom is going to give birth through the vaginal canal, if that baby's head was made out of bone. Yeah, it would be maybe like 10 times the normal ouch, which is bad enough. Because what we need is for that baby's head to be willing to kind of bend and flex as it comes out of the vaginal canal. Same thing with like the bones of the shoulders. They're going to squish together. I mean, sometimes these kids come out looking pretty funky. I've seen some children who are born and they have like cone heads because they've been squished through this little canal, and all those bones of the head come out looking like they got a hat on their head, and now the baby comes out and you're just trying to do this before mom sees it, because it's looking really strange right now, okay? And the same things with the shoulders. They can be pretty lopsided and looking different because the cartilage, the pre-bone you might say, is so much more flexible than hardened bone. So we want the cartilage to be produced first, and this is also why, you know, it's really difficult for babies' bones to break. So if you're working in the hospital and somebody brings in, let's say, a 2-month-old infant, and they have a broken arm and a broken leg, and mom says, oh, well, the baby fell out of the stroller. No? You don't agree with that? Why not? Baby fell out of the stroller. Why didn't they break the arm and break the leg? Because that cartilage literally is so flexible, you could do this with it. It doesn't snap very easily. You know, babies are like so flexible they practically bounce, okay? And so some kid just falling out of a stroller, there is not enough impact to snap that arm or leg. You can't break that cartilage. It's very difficult to do. And many times we see when little babies have a broken arm or broken leg, what somebody has most likely done is taken that arm and done this to it. Or they'll take that arm and do this violently to it. So does the amount of force that's necessary to break that arm or leg match the story that the person is giving you? And of course, falling out of a stroller, absolutely no way. Now, as the child ages, the cartilage begins to turn into bone. You start to reform the cartilage, and you start to get osteoblasts in there, And how we turn cartilage into bone is we need to harden it. And you add a lot of calcium to this cartilage. And calcium is really, really good at making the bone super duper hard.
What's that condition called where when you're born, like your bones do not shape great pieces? So like sometimes they could be used, but
Osteogenesis, osteo something imperfecta. I can't remember the middle term now. It'll come to me, but the last word is imperfecta, and they have like glass bones. Their bones are hard, but they're not thick, and so just the littlest thing happens and their bones break.
Okay, question. My friend, when he was born, the doctor pulled him out and he messed up his arm, and now it's all messed up and it's been like that all his life, and there's no fixing it. Did that have to do with because of the cartilage, or did the doctor like break part of him and not know it?
I have no idea, and so just nobody noticed that his arm was messed up, or
I don't think so, because I forgot how long he said until they noticed, because it's always just at a weird angle, and it's always been that way.
it could have been just coming through the birth canal. It may have dislocated, and it's strange that nobody noticed. I don't know. I'm not really sure. All right, so I want you to know that there are 3 different types of cartilage. The first type of cartilage is called Highland cartilage. The word Highland means glassy. So when you look at it, it kind of looks like a piece of glass, sort of glass with purple and pink tint to it. And Highland cartilage is very protective. So we have Highland cartilage all along the ends of every single one of our long bones. So at the ends of the bones of our arm, at the ends of the bones of our leg. Now Highland cartilage is also very smooth, okay? And Highland cartilage needs to be like that because now imagine you're walking all day long. This bone is constantly moving in its socket. And this bone has the ability to hit up and knock on other bone. And when bone hits on other bone, it'll take chunks out of it. It'll create holes in it. And we call this arthritis. But instead, you cover all these bones with a really thick layer of protective Highland cartilage. And now the bone can hit on other bone, but the Highland cartilage is like a bumper or a cushion that doesn't allow the bones to actually touch each other. It's just the Highland cartilage that touches each other. And it takes a long time to wear away that Highland cartilage. Now eventually we can, if we're not careful, we can wear it away and we can eventually produce arthritis in bones. But Highland cartilage, very important at protecting the long bones. You also have some Highland cartilage in your nose. You have some Highland cartilage in your trachea as well. And that's all for protective mechanisms. The second type of cartilage is called fibrocartilage. Fibrocartilage is very strong. It's the strongest type of cartilage we have in our body, hands down. And fibrocartilage is found in between each one of our vertebrae. So our vertebrae stack on top of each other, kind of like this. And the problem is, if each one of these vertebrae were right on top of each other, and because of the fact that we are animals that are erect, there's a lot of pressure on the bones of these vertebrae. So fibrocartilage makes like little pillows in between. Literally, it looks like little pillows that sit in between. And these are our intervertebral discs. We have them in between the vertebrae. We also have them in between the bones of our knees because we need a lot of cushion there as well. So fibrocartilage, very important in helping to keep these bones apart. So if you've ever heard of somebody say, oh, well, I blew out a disc in my back, or maybe they might say, I slipped a disc, that means that something went wrong with the pillow or the intervertebral disc in between their vertebrae. If those blow out, then your bones hit on each other, and that is very painful. And you get a lot of arthritis in there, and usually what they end up doing is they'll fuse, they'll literally bond, like kind of like super glue these bones together. Now the only problem is once they get bonded together, you don't have a lot of flexibility. So you can't really move your back quite as much as you used to before when they do this. Yeah.
That happened to my dad, and they said that if they were going to do a surgery, he would lose most of his mobility. Is that why?
Yes.
Does that make any difference with a person with scoliosis? Like,
Difference meaning what?
with the cartilage being there, does it have any relation with scoliosis? Is there too much or too little?
No.
No?
So our vertebrae is pretty much straight. There's a little bit of curve in our vertebrae. So there's a little curve in where our neck is located, a little curve in with the back. So we have kind of this curve in, middle of the back curves out, towards the lower back it curves in again. But if you look at somebody's vertebrae, they're pretty much up and down from each other. A person with scoliosis, the vertebrae can be at angles. So they may have the curvature in at the neck and in at the lower back, but they also have curvatures to the side. So instead of the vertebrae being up and down, they can do kind of this S type of thing, which if it's really bad curvatures, that means part of the upper body can be on one side, the lower body can be on another side. That is not affected by the intervertebral discs. That's just affected by how the muscles are attached, and it's also affected by genetics. Yeah. And usually to fix that, what they're going to do is they're going to drill holes in this bone, and then they're going to put long metal rods through all of these bones and then pull those bones together in a straight line, so there's metal rods on each side in order to make sure the vertebrae are straight up and down instead of in this more twisted angle. And you'd think, if you watch this, literally, when they're doing this surgery, they're actually using power tools like you buy, at Home Depot. And they're using, some kind of drill to drill the holes, and they're using hammers to chisel things, and you think, holy crap, this guy's going to be like paralyzed or in so much pain. And when the surgery's over, the guy's straight up and down and walks out and goes, I've never felt so good. Like, oh my goodness, that surgery looks so primitive and just horrible, but they walk out feeling great, so that's really the good thing.
So if you have like a bulging disc, how do they treat that? Because I have two of them on my upper C-spine.
They don't.
They just say that they heal on their own. Like I've had them for years now.
They don't typically heal on their own, and they don't do anything about it. Okay. Good luck. All right, so the last type of cartilage is called elastic cartilage. This type of cartilage is very flexible and bendable. And so you've got elastic cartilage in your ear, in the pinna of your ear. So you can bend this and it comes back. Okay, that's full of elastic cartilage. You've got elastic cartilage in the end of your nose. So you can push on that and it comes back. So anything that needs to be a little more flexible, a little more bendable, is typically made out of elastic cartilage. So this is a picture of cartilage. And these cells here that are sitting in the middle of the cartilage, which actually helps to make cartilage, these cells are called chondroblasts. So if it is going to be something that has to do with bone, we use osteo. If it's something that has to do with cartilage, we use chondro. So this is a cell that helps to grow cartilage. This is a chondroblast. Now once the cartilage is fully grown, we change the name of that cell. Can you guess what the name would be? Chondrocyte. Very good. There is a type of cell that helps to constantly reform bone. And then there's another type of cell, very similar, that helps to reform cartilage. So let's talk about bone first. The shape of your skeleton right now is not going to be the same shape next year. Your bones, my bones, are constantly changing shape. So for instance, if your mother ever told you, you need to stand up straight, okay? There's a reason, because if you're slouching or hunched over, eventually your bones will reform into that shape. So if you've ever seen, maybe an elderly gentleman who is so deformed in the spine that he's hunched over like this. There's a couple problems with this, because the bones will actually start to reform and change shape. And if you hunch over like this too much, it also causes squishing in the digestive tract. There's not enough room for all the internal organs. And then they have all types of digestive problems to the point where it could actually kill them. So these cells that are constantly reshaping our bones, depending on how we're standing, maybe the type of job that somebody has, that they're always having to reach over to the right side to do something, and then reach over multiple times a day. Eventually these bones will actually change shape so that it's not as difficult for them to reach. The bones will reform themselves if they do that repetitive motion enough times. These types of cells that are constantly reforming, they eat parts of bone and then they help to reform the shape of the bone. These are called osteoclasts. Now, osteoclasts, they are very sensitive to a certain type of vitamin. This is vitamin D. Told you. Why do we need vitamin D? What's vitamin D good for? At least one thing it's good for when it comes to bone.
It builds calcium.
Say it again.
It builds calcium.
Okay. You need vitamin D in order for you to put calcium into your bone. If you don't have enough vitamin D, you won't have enough calcium in your bone. And calcium is what makes our bones hard. So you have to have a high enough level of vitamin D to have enough calcium in the bone for them to be hard. So, what if I told you, I have a patient who's come in and we've tested her level of vitamin D. And normal, healthy levels of vitamin D are around 80. Her levels are 6. Would you be surprised if I told you that she's complaining of really bad pain in her back and feet? And when we did x-rays, we found that although she was only 25 years old, had severe arthritis in both feet and in the vertebral bones of her back. Why, at 24, does she already have arthritis? Oh, by the way, let's ask this question first. What is arthritis? It can be caused by rubbing of bone, but basically arthritis is where the hardness of the bone is like wearing away. You're actually seeing holes in the bone where it should be nice and compact and strong. It's starting to look more like spongy bone. So rubbing together can cause that, but so can a lack of vitamin D. Because when you have vitamin D, so you have high levels of vitamin D, you have more calcium in the bone. So now, again, this patient has extremely low vitamin D levels, which means not as much calcium in the bone. And if there's not enough calcium in the bone, then the bone starts to wear away. Now, by the way, osteoclasts, these are going to be turned on when vitamin D is low. So if a person doesn't have enough vitamin D, osteoclasts act like little Pac-Men, and they go around and chew up and eat up the bone, and can cause holes in the bone, cause the bone to become weak. You can get breaks in the bone. You have lots of pain in the bones. You get arthritis in the bones, even though she's 24 years old. Severe arthritis in the feet and in the back. Can that be reversed? How? Super high levels of vitamin D. What are normal levels of vitamin D that you should be taking at minimum every day? About 2,000 units of vitamin D minimum every day because you live in the high desert. Vitamin D is produced in our body when we're out in the sunshine. The sunshine has to directly hit your skin, and you have to be out there for more than 20 minutes. 20 minutes is a minimum. When's the last time you stood for more than 20 minutes in the sunshine? Barely in the high desert anybody does. Because either it's too hot or typically too cold out here. So my guess is the majority of you in here are vitamin D deficient. That's why she takes vitamin D supplements.
All the doctors tell that. You're vitamin D deficient. I start taking it.
Yeah. Well, that also means you need to take it. Question? Hang on, I cannot hear.
I heard like up north, like in like Washington or Oregon, where there's like no sun, people lack vitamin D, and there's like a correlation with high suicide rates.
There
so how
is.
does vitamin D correlate with people's thoughts of suicide?
Well, nobody's quite sure. But some scientists have speculated that vitamin D is actually not a vitamin as much as it's a hormone. And it can do more than just affect your bones. It has the ability to affect your heart. It can affect your kidneys. It can affect your nervous system. How it does it exactly, they don't know yet. But yes, you're absolutely right. Low vitamin D, much higher rate of suicide. Low vitamin D, higher rates of heart attack. Low vitamin D, higher rates of kidney failure. So it can affect multiple different organs. So yeah, absolutely right.
So how long do we have to be out in the sun?
Minimum of 20 minutes. Minimum. Or just go buy some vitamin D. That would help too. All right, let's get started. So we've been talking about bone. We've been talking about cartilage. I want to talk for a little bit about connective tissue. So there's a couple different types of connective tissue, and one of those is called dense fibrous connective tissue. We find this connective tissue making up what we call ligaments and tendons. So you need to know that a ligament is a connective tissue that connects bone to bone. A tendon is dense, fibrous connective tissue that connects muscle to bone. Okay, so a ligament connects bone to bone. A tendon connects muscle to bone. And these are both made out of dense, fibrous connective tissue. And this is what dense, fibrous connective tissue looks like under a microscope. It's very thick, and it has a lot of a substance called collagen in it. Collagen is extremely strong. As a matter of fact, if you could get collagen and make it like the size of a metal pipe, it would be 100 times stronger than a pipe made out of steel. So if you could build buildings out of collagen, they'd last a lot longer. Of course, we don't have that much collagen, but our collagen is very, very strong, which is really important because if we have this connective tissue that connects bones to bones, you don't want it to be able to rip very easily, or it connects muscle to bone. It's very difficult to tear a tendon unless you have a really bad accident. So we've already talked about this. So what is this end of the bone called? This is the epiphysis. What's the shaft of the bone called? Diathesis. Very good. What's the hollow region of the bone here called? Inside, yeah. Exactly. Perfect. Or better known as the marrow. And what is this yellow marrow made out of? Fat. Excellent. And what's the layer that covers the outside of the bone and has stem cells in it? Periosteum. Excellent. Nice job.
That's what I'm talking about.
We've already talked about this, so I'm just moving on. You ready for the test? Which, by the way, you know is next Tuesday, yes? Yep, your test is next Tuesday.
Open notes?
Yeah, you wish.
Can we use your phone?
You wish.
Wow.
All right, so let's look at this. This is how bone forms. So we're going to start with the cartilage model, and then around the outside of the cartilage, we develop the periosteum. So all those stem cells. Now those stem cells are going to turn into osteoblasts, and those osteoblasts are going to start working in the epiphysis, which is the end of the bone, as well as the diathesis, or the shaft of the bone. So you have a region where the cartilage is going to turn into bone. And when cartilage turns into bone, we call this ossification. So when we go through the process of ossification, we're turning cartilage into bone. So we have basically two major sites for ossification. We call it a primary site and a secondary site. So the primary site is in the shaft of the bone. The secondary site are on the ends of the bone. So this bone is growing thicker. It's also growing longer. Now, in this region right here, it's still cartilage, and in this region, we're turning the cartilage into bone. So notice here, all of the shaft of the bone, or the diathesis, has actually ossified. It's become bone. The end of the bone here has also ossified, but there's cartilage right here. So there's a line between where bone is being produced and where the cartilage is. This line is really important. It's called the epiphyseal plate. So this is that line where we see the cartilage and the bone meeting at the end of the bone. This is the epiphyseal plate. Now notice eventually that cartilage completely goes away. And there is no line because everything in the end is just pure bone. If you're looking at an x-ray, you can see this line between cartilage and bone very clearly on an x-ray. And so you know that there's an epiphyseal plate there. What this tells you is that the person is still growing. As long as there's some cartilage left, as long as there's an epiphyseal plate, the bone can get longer. This cartilage allows the bone to grow longer. Well, the bone grows longer and you get taller. When the bone totally ossifies, there's no epiphyseal plate, the person's not able to grow length of bone anymore. Usually the epiphyseal plate in an individual is completely gone by around the age of 25. So your bones completely ossify at about 25. So some people may basically stop growing at maybe around 18, but you could actually have a growth spurt around the age of 25. There are some people who will put on like 1 or 2 inches when they're older. Question?
How come I haven't done since middle school?
Couldn't tell you. It doesn't, girls do not necessarily stop growing before men. It's all very genetic. By the way, there is a problem for some people where their bones don't grow as well, and this is what we call dwarfism. There is a hormone that's necessary to cause bone growth to occur, and this hormone is simply called growth hormone. Helps growth of bones to occur, so you grow. Now it does more than just to help bones to grow. It also causes all of your internal organs to grow. And as long as growth hormone is being secreted at the right amounts, you're going to grow to whatever height you're supposed to grow to. And again, that's very genetic. And of course, all your internal organs should be the right size for your body. However, a couple of things you need to know. One is that you don't make growth hormone unless you're asleep. So if you don't sleep very much and you're still growing, you actually will not grow as tall. So maybe that's why you didn't grow as tall, because you didn't sleep like you were supposed to. So, you know, when your kids won't go to sleep, you tell them they're going to be short. If they don't sleep, they're going to be short. There are some people who will also have a tumor in their brain because growth hormone comes from an area of the brain called the pituitary gland. So the pituitary gland helps us to make growth hormone. And some people will have a tumor there, and one of 2 things can happen. Either they make too much growth hormone, or they make too little growth hormone. Now, if they make too little growth hormone, they may have a problem that's referred to as dwarfism, which means that they're shorter than they should have been because their pituitary gland isn't working appropriately. You don't really see people with dwarfism anymore because you can give a child shots of growth hormone now and cause that individual to grow to their regular height. I had a student a few years ago. He was about 6'2", something like that, and both of his parents were under 4 feet tall. So they knew that he was born with the same growth hormone defect that they had, so they had been taking him to UC Irvine to receive shots of growth hormone during his growth time before the age of about 20, so that he could be what his normal height would indicate he should be. Now, sometimes people will make too much growth hormone, and if they make it before this epiphyseal plate turns to bone, that means they will grow very tall, and they will have a problem we call gigantism. And that means that this individual can be well over 7 feet tall. You're talking, the tallest man in the world is 8.5 feet tall. No. Because here's the problem. Many of these people that become much taller than they were meant to be because they've had a tumor on their pituitary gland, their bones and their internal organs are not the right size either. They get much larger than they were meant to be. And these people are usually very ill. So they have a lot of bone problems, they have a lot of cardiovascular problems. They couldn't play in the NBA if they wanted to. Now we're not talking people who genetically, they're going to be very tall. They might be 6'10", 7 foot. Those people are meant to be that tall. They don't have any disease that causes them to make too much growth hormone. And so all their internal organs and their bones are the right size for their body. But these individuals that get gigantism, their bones are too thick, their organs are too big, and they have a lot of difficulties.
Can it happen to where the growth of the bones and the organs are the same?
Not normally. I mean, it could, but normally when you're talking about gigantism, is that what you're talking about? Yeah, normally the bones are going to be huge too. I mean, the bones can be so thick that they have a hard time walking. So many of them end up in wheelchairs because their bones are so heavy, they can't really even walk.
So I'm thinking is like someone really tall, but they're really small. It's not strong enough.
Not normally. Yeah, normally the heart is gigantic also. So usually the heart's about the size of your fist. Their heart can be this big, a foot long.
Subway sandwich?
Yep. Not good. Now, if, let's say, the person gets a pituitary tumor, let's say after the age of 25, their epiphyseal plate is already ossified, it's turned into bone, the bones can't get longer, but they can get thicker. And so what happens is this person doesn't get any taller, but their bones get much, much thicker. And they have a disease that we call acromegaly. So that if you look at the individual, they kind of look sort of like a Neanderthal man. The forehead gets so thick it starts to protrude. The jaw gets very, very thick. Their hands are huge because their fingers are much thicker than they should be. And again, they have a lot of difficulty walking and moving because their bones are so heavy. This is just a picture showing you. This is the shaft of the long bone, the diathesis. This is the periosteum around it. This in darker pink here, this is the compact bone. And then this is the end of the bone. And it is still, I think it's ossified already. It's turned into hard bone. What is this? This is actually a really super duper thin slice of bone that was made on what's called a microtome, and the blade is a diamond.
That's tight.
This is just another picture showing you where the growth plate is located. So you can see this is the spongy bone above, and then this is the cartilage still growing and where the two meet. Okay. So these are some of the functions of our skeleton. One of those, of course, is structural, so that it helps us to keep our shape, our form, to be able to walk. Another one is its protection of all of our body organs, like our heart, our lungs. So the rib cage goes around that, helps to protect the organs. It also is for production of red blood cells and white blood cells. White blood cells are part of our immune system. Red blood cells help to carry oxygen. And then it helps to store minerals like calcium, magnesium, phosphorus. These are really important minerals that our body needs. And it also helps to store fat. We have fat in the bone marrow. And then, of course, for movement of the body, because our muscles are attached to bone, and the muscles move, and then so do our bones.